The government and NHS England are being accused of failing to take meaningful steps to tackle the rising cost of clinical negligence. That's according to a new report from a group of MPs.
So we just wanted to explain exactly what we're talking about, right, and look at some of the numbers. So this is the Public Accounts Committee and the government's liability for clinical negligence, so in other words, people suing the NHS, effectively, has quadrupled over the last 20 years to £60 billion.
Claimant legal fees more than tripled to £538 million in the year 2024 to 2025.
And in some cases, there was a cost-to-damages ratio of 3.7 to 1, which means, if you're wondering what that's all about, like me, it means that victims are paying more in legal fees than the damages that they would actually receive.
And by the end of the decade, settlement costs are estimated to rise over £4 billion.
So this is a massive deal. Let's talk to Sir Geoffrey Clifton-Brown, who is chair of the Public Accounts Committee, who joins us. It's obviously important to say that every one of these claims is somebody who something awful has happened to, right? But at the same time, it's an awful lot of money that, taxpayers at the end of the day are having to fork out.
So thank you for explaining the numbers, but as you quite rightly say, every single one of these cases is a human tragedy. Something's gone wrong, that's why they're making a claim. But as you say, the total nation's liability, £60 billion, quadrupled in the last number of years, but unfortunately rising to £4 billion each year. So this is a big, big subject, and the money could usefully be used in the NHS to provide other services. Yes, of course.
If things have quadrupled, do we put that down to there being 4 times worse health outcomes or 4 times more outcomes that cross the line to being clinically negligent? Or is there a change in the ability for people to hold the NHS to account, or is it somewhere in between?
So I think what we found was that there are a small number of very large legal claims, and some of them can go up to £11 million and take 11 years to settle. And this is what's really pushing the cost up. Of course, there are the ones at the bottom, as we've already said, where the legal costs are unacceptable for claims under 25,000. 3.7 times the legal costs on those 25,000 than the claimant is actually getting. But it's the big ones at the top that are really pushing the bill up. And of course, it's a legal bill as well. £537 million legal bill each year, one of the largest legal bills in government.
So what can the government do? I mean, is this basically a case of saying, actually, you know what, the government just needs to stop making these, or not the government, the NHS just needs to stop making these mistakes? Or actually, should we be thinking a bit more about, is it right that this number of people are able to take legal action against the NHS?
Well, so there are a lot of things in that question. Yeah. Basically, at the bottom end, if the National Health got it right first time and reduced the number of claims, of course, the cost would come down. So what have they got to do to reduce these numbers of claims? They've got to look systematically where mistakes are made and systematically look across the health service to see how they can put it right. It might be by exchanging better data. It might be by better training where things go wrong. But that's a relatively simple thing to put right. And we've got Baroness Amos' review into health safety at the moment. We've got David Locke QC's recommendations looking at the whole system. They will undoubtedly make recommendations, but the NHS itself really needs to learn the lessons to try and reduce all of these instances.
In terms of the top end of the spectrum, what sort of examples, presumably some of those have been settled, so you can talk about them. Are those avoidable going forward? Are there obvious areas of errors where we could scrub out those particular payouts in future?
Well, they are, of course, the more complex ones, often where the greatest damage has been caused. And, of course, what the settlement is involving is a settlement for the damage done for the life. And if you've got a child that's been damaged, you're settling for the life of that child on things like healthcare provision, housing, loss of job earnings. All of these things are taken into account at that final hearing. But there is one thing that we do highlight in our report, and it's this. In that settlement, they are providing for that person to have treatment, private treatment, for the rest of their life. very often that person then goes off and gets treatment from the National Health. So effectively the National Health is paying twice. So we think that the law needs to be changed. So at the time the settlement is made, at the time of the court case, the judge is able to inquire as to what sort of care that person is expecting to have. And we think that could reduce the complexity and the costs at the end of the day.
It's important, you know, as you did at the beginning, to reflect on how awful these tragedies are for people. We're talking about children here, we're talking about people giving birth. It's the worst possible thing. And I know you talked about the higher payouts. I was really struck, I have to say, though, with that stat what we did on the legal costs. Is there an issue with some lawyers, you know, I guess kind of an awful lot of money going out on lawyers?
Well, I've talked to the lawyers at the highest level in this country, and they all recognise that. We haven't made specific recommendations how the legal system needs to be reformed, but I guess it's like the health system, it's too complicated. The health system is fiendishly complicated. The poor people who are delivering this care are operating under a fiendishly complicated, huge number of recommendation system. The legal system is the same, and I think we need to be looking at the legal system to see how we can simplify it. And after all, what we should really be doing is looking for alternative dispute resolutions, trying to keep these cases out of court, settle them quicker so that the claimants get the money quicker, and NHS resolution is starting to do that. And what is really tragic, we found in our report, is actually lots of people get into the litigious system, the legal system, because they're not getting answers from the health service. They simply need answers. Once they get answers, they then feel more happy about the situation. And I think the NHS could do a lot to resolve that.